Hi everyone, welcome to Allied Health 209 Laboratory Testing. Although we are having face-to-face classes for our laboratory testing lecture and laboratory class, in a way to make sure that we cover all of our material due to some time lost with the winter storm, I'm going to be placing several videos online on Canvas that you can use to not only start studying for quizzes and tests we have coming up, to make sure I get you out backup information that you will need. As we discussed in class on Monday, we will be having our test for both quiz number 2 on tube colors, and soon we will be taking our lecture test number 2 on chapters 3, urinalysis, and chapter 9, toxicology, which are up on Canvas. So the thing I want to do is start off talking about quiz number 2 that you guys are going to have, and it's going to be on tube colors. So this little slide here will really help you guys be able to study and use this as a study tool to get ready for that test. As I told you in class on Monday, in your black lecture binder, there is a study guide specifically for each and every quiz. So make sure that you have tabbed your black binder for lecture and that you are familiar with everything that is in that binder, so that you will be able to quickly get to each and every one of your study guides for each individual quiz. So please make sure that you use these slides by pausing them at each question and see if you guys are getting the correct answer. It's a great way to study. So let's get started. We're going to talk about what color tubes can be used to draw the following test. So we're talking about hematology tests that are done in the hematology department of your lab. The first test that we talk about, and one of the most common tests done in hematology, is a CBC, or a complete blood count. So pause this video and see if you're getting the right answer for what color top tube do we draw a CBC in. Purple, right? Also remember that purple top tube has an additive in it. And always remember, guys, anything that is in a tube is an additive. But the particular additive that is in our purple top that we use for a CBC is EDTA, which is an anticoagulant. And remember, an anticoagulant, as we learn in medical terminology, is something that prevents the blood from clotting. What about a sed rate? Pause this here and see if you get the right answer. As we go through, make sure you're pausing each one of these tests as they pop on the screen to see if you are getting the right answer. Purple. And remember, anytime you're doing phlebotomy, and you know that you're going to have to draw a light blue top tube, which we know that our light blue top tubes are used for our coagulation studies, such as PTs, PTTs, factor assays. These tubes have an additive in them as well. It is also an anticoagulant, which is sodium citrate. But remember, when you draw a light blue top tube, you may very well need to draw a discard tube. Our discard tube is a plain red top tube. We will then be drawing out of order. As you know, in our flower picture that everyone has in their binder, is just a way to help you learn the order of draw. And we realize that in the order of draw, we do not draw a red top before a light blue top. But in certain situations, we would need to draw this discard tube, which would cause us to draw out of order. So remember, if you're drawing a PT, there's two reasons you will need a discard tube. One is if the doctor ordered any other test with the PT. For instance, if the doctor ordered a PT and a CBC, then you would need to draw a discard tube. The second reason you would need to draw a discard tube is if you were drawing your blood with a winged infusion set or a butterfly. Due to the blood that is in the tubing of the butterfly apparatus, and due to the fact that our PT or light blue top tube needs to be 100% full, we know that the minute we push that tube onto the inner needle, it will start drawing in, and it will draw in blood, air, or whatever. And so because there is air in that tubing, if we don't draw the discard tube first, our light blue top will be underfilled, which could cause us to give out erroneous results. So remember, if the doctor orders any other test, or if you are using a butterfly needle, you will need a discard tube. And remember that PT is drawn in the light blue top tube. So now let's move from hematology tests that are drawn in those purple top tubes or that light blue top tube that is taken to the hematology department. Because remember, not only in the hematology department are there hematology tests done there, but also urinalysis are done in hematology, and there's a section inside the hematology lab where the coagulation instrumentation is held, and you will take your coagulation tubes to that section of hematology. Hemoglobin A1C is a chemistry test. Pause it and see if you can guess or see if you have studied well enough to know what tube a hemoglobin A1C is drawn in. What about the electrolyte profile? A glucose test. And if you'll see, the electrolyte profile has the green, the red, or the SST. The glucose test has the green, the red, the SST, or the gray. Now remember, if we are drawing an electrolyte profile and our doctor has ordered this stat, which one of these tubes do you think would be the best choice for the electrolyte profile if it were ordered stat, or if you were worried about turnaround time? Okay, the answer would be green. Why? Because the green top tube has an additive in it. That additive is an anticoagulant. It's heparin, either ammonia heparin, sodium heparin, or lithium heparin. So we do not have to wait on that tube of blood to clot before we can spin it down and run our electrolyte profile. The red top tube can take anywhere, because it has no additives in it if it's a glass red top tube, it could take anywhere from 30 minutes to an hour to clot before you can even spin it down to do your electrolyte profile. So you can see where if the doctor ordered the electrolyte profile stat, you would not want to use a plain red top tube, or frankly even a plastic red top tube if it's ordered stat, because the plastic red top tube and the SST tube, they both have additives in them as well. Let's take the plastic red top tube first. The additive in a plastic red top tube is silica. That's that dusty white powder you see lining the inside of the tube. That additive is there to help speed up that clotting time. So a plastic red top tube with silica as an additive will clot in anywhere from 5 to 15 minutes. But still, you have to wait anywhere between 5 or 15 minutes for both the red top or the SST tube to clot before you can even spin it down. Then you can take it off and run your electrolyte profile. So we can see where drawing that green top tube would save us anywhere from 5 minutes to an hour on our turnaround time. So it would be the best choice. Now, something to keep in mind is we would not want to use sodium heparin as our anticoagulant, because the electrolyte profile, as we know, has sodium, potassium chloride, and bicarbonate. And if we use the sodium heparin, it would falsely elevate our sodium result, and we would be reporting out erroneous results. So we would want to make sure we use an ammonia heparin or a lithium heparin. And also, one of the benefits of the SST tube is that it has two additives in it. First, silica, that we've already discussed, how it is that white powder that speeds up the clotting process, but it also has gel in the bottom of it. Now that gel is nice because we don't have to take some of the serum off of the cells, because we never want to leave the serum sitting on the cells, because that gel's job is to move up during centrifugation and put a barrier between your serum and your cells. Now, the gray top tube is that additional tube we see that we can use for glucose tests. Now, the reason the gray top tube is great is because it has an additive in it called sodium fluoride. Sodium fluoride is a preservative that preserves that glucose so that the glucose that was flowing around in our patient's veins stays more stable between the time we draw the blood and we go to run the glucose. So we get the most accurate glucose result we can. Most of the gray top tubes also come with an anticoagulant in it. Let's discuss microbiology tests. Blood cultures. What do we draw blood cultures in? Either the yellow top tube, that represents the yellow sun in the sky in our flower picture that helps us learn the order of draw, which has SPS in it, or more commonly, we draw 2 blood culture bottles with a syringe. Okay, strep and antistreptolysin O, ASO, is either a red or an SST tube. So we can see if our doctor did not order our electrolyte profile stat, and he did not order our strep test stat, we can see where we can do approximately 3 tests per tube of blood. And we always want to draw the least amount of blood in the least amount of tubes as we can get away with, right? Because we don't want to take any more blood from our patient than we need to. So we can see that if we had a strep ordered, an electrolyte profile, and even a glucose, all 3 ordered at the same time, all 3 of those can use an SST tube. And that is the tube that would be best to use because all of those tests can be done off that one SST tube. It has silica in there, which will speed up the clotting process, and it has gel in there so that it will separate the serum from the cells. And remember, this is that order of draw picture that helps us understand that this is the order we draw our tubes in. First yellow always, which represents blood cultures, then light blue, red, then SST, then green, then purple, then gray. Unless we're drawing a light blue top tube, and then if another test has been ordered with it or we're using a butterfly, we will have to draw a red discard tube, and we will unfortunately have to draw out of order. So make sure you are studying that study guide for quiz number 2, okay, and getting ready for that test. As we talked about in class, that test is going to be here most likely either will be that Monday as soon as we come back from spring break. Now, this will also be a big part of quiz 2, okay? What anticoagulants are each tube? You need to know that sodium citrate's in the light blue top, EDTA is in the purple top, and that you have heparin, whether it's ammonia, lithium, or sodium in the green top tube. You need to understand the order of draw. You need to understand discard tubes, right? You need to know the 2 reasons we talked about. You need to understand that the PT must be transported to the lab within 1 hour and the PTT within 4 hours. You must understand that all tubes must be filled at least half full except the light blue top and the purple top tube, which must be 100% full. Tubes for tests like bilirubin or any panel containing a bilirubin test must be protected from light by either covering the tubes with aluminum foil immediately after the blood is collected or placing it in some type of bag that is amber color or collecting it in an amber colored container. Remember, if that tube is not protected from the light will break down the bilirubin and falsely lower our test results. Also keep in mind, if the panel or test you're drawing is ammonia, or if that panel has an ammonia test in it, you would not want to use a green top that had ammonia heparin in it. Consequently, if your doctor has ordered a lithium test on a patient, you would not want to use a tube that had lithium heparin in it. It will falsely elevate your lithium results. It will falsely elevate your ammonia results. And as I talked about earlier, if sodium is what's ordered or sodium's a part of that profile or panel, you would not want to use sodium heparin as it will falsely elevate your sodium. Also remember, the only tubes that do not have an anticoagulant in them are the red, white, and SST tubes. The blood must first clot before it can be spun down in the centrifuge and the serum pipetted off into another tube for testing. Remember, a tube with no silica can take from 30 minutes to 60 minutes to clot, and a tube with silica or an SST tube can take anywhere from 5 to 15 minutes. Remember, you need to understand what our report forms are. Remember, documentation is vitally important. These can be called into the court for court documents. As you know, there's different organizations that come into our labs and inspect us, so we must make sure that all our report forms are done accurately and correctly. What is a requisition form? Remember, this is the form with the doctor's orders on it for the test he wants you to perform. If the doctor wants you to collect a urinalysis and do a urinalysis, he will put that on the requisition form. If he's ordering a PT, a hemoglobin A1C, that will be found on the requisition form. The report form is the form the test results go on. So if we do an electrolyte profile and a urinalysis, a CBC, a report form will be printed out with the patient's demographic information at the top. Okay, so we have the correct patient, and then the test that was ordered, all those tests will report out on there with the results on that particular patient, plus the reference ranges, so that you can compare your patient's results to the reference ranges to make sure your patient fell within normal range. Remember, sometimes that requisition form can double as the report form. It is used for the doctor to order the test, and it is used for you to write down the test results on. So if the requisition comes down and one person draws the blood, they will put their initials and the date and the time that they drew the blood, take the sample, deliver it to the chemistry department, and then if you're in the chemistry department running the glucose, if that's what the doctor ordered, then you will run that test, write down the test results, put your name and the date and the time that you performed the test. You will compare it to the reference range to make sure that your patient's glucose results are normal. Then those report forms are either stapled to the patient's chart or uploaded electronically into their electronic medical record. So where are the requisitions located in real life? And then where are they located in class? So remember, in real life, they can either be handed to you, the medical assistant, lab assistant, or phlebotomist, to you by the physician himself, or they can be placed in the patient's chart, or they can be uploaded to the patient's electronic medical record. They can also be sent to a printer that is located in your lab and print out in your lab. We know that in the classroom, our worksheets have our requisition forms in there, as well as they have our dummy charts, our dummy patient logs, and our dummy QC logs. Guys, make sure you're taking your packets out that we're working on in lab, face-to-face, out at home, and make sure you're getting familiar with it. You're seeing what we're doing next. There's a lot of useful information in there, and I've told y'all, you don't want to just check those boxes. You actually want to read this stuff. It helps you learn, okay? So where's the patient's chart located in both real life and in the classroom? We know in real life, a lot of times they can be filed at the front of the doctor's office, okay? And then they'll pull that chart and have that chart follow the patient around until they're finished. Then whatever charting needs to be done is done, and then it is filed back up in the front of the doctor's office. Unless your doctor's office is fully electronic, and then you may have a handheld pad of some sort that you go, or laptop that you go into your patient's room. You upload all the information and do all your charting electronically, and it is filed to the patient's electronic medical record. Okay? In this class, we know that the back of our worksheets, we have our patient's charts. Again, talking about report forms in both real life and in our classroom. We understand that a lot of times those report forms are either stapled to the patient's chart, okay, or they can be electronically uploaded to the laboratory section of that particular patient's chart in their electronic medical record, okay? And make sure that you look, because there are charts for each one of the patients, whether it's John Doe, Jane Doe, or your lab partner, that we have in our worksheet that we're responsible for homework, making sure that we do our charting and our documentation. Make sure you're familiar with all that, like I tell you in lab. Okay, now let's talk about that patient log. Okay, in real life, there is either electronic patient log that is located inside the computer system, inside the hospital or clinic's computer system, or you can have a 3-ring binder located in the laboratory that's the patient's log. Sometimes you can be partly electronic and part written record. And in other words, you may have electronic requisitions that print out that have stickers that you peel off, and there's a sticker on that electronic requisition form that you peel off and stick onto your patient's log that is in a 3-ring binder housed inside your lab. And it could be at some point someone's job to then take those logs and scan them into the computer. In our classroom, we know that at the back of our packet of worksheets, we have a dummy patient log that we use to log our patients. So make sure you're keeping up with all your documentation that needs to be done in your worksheets. Where are quality control logs and Levi Jennings chart located in real life and in the classroom? Okay, we know in real life they're in the lab, in either some type of binder in the lab or inside the computer software in the lab where you run your quality control and then you log it into the computer or log it onto a quality control logbook. Same things with the Levi Jennings charts. Those are either located in a charting system in paper in your lab, or they could be housed inside a computer software system in your lab. We know in our classroom that we have our quality control log in the back of our worksheets. And we always flip back to those to see if quality control has been ran before we run our patient's test. If they have not been, then we are responsible for running that quality control. And we know that CLIA says that we must run 2 levels of controls each 8 hours of our shift anytime a patient has been run on that particular test. And you must run them first, make sure they come in range before you ever use that instrument strip or anything on a real patient. We know that this is, of course, this could be different sometimes, but this is just a generic, typical doctor's office floor plan. Please make sure you're familiar with this. We went over this many times before, okay? And just remember, if you just have to do a procedure on a patient like drawing blood or collecting urine, where should this be documented? Remember, you must document it on the requisition form, the date, the time, and the initials of the person who drew the blood. And then you did something to that patient or with that patient, you must chart it in their chart. Okay, if you have to do an actual laboratory test, how should this be documented? There's some additional steps with that, right? You still need to fill out the requisition form. It still needs to be charted, but you would also need to check the QC log to make sure that QC had already been ran on whatever test your doctor ordered, or you need to run QC on whatever test your doctor ordered before you do the test on your patient. And then you must log on your patient log every patient that you do a laboratory test on. Now make sure we do this in lab. We do this in lab every Monday and every Wednesday in lab. But guys, make sure you find your charts. Make sure that you are checking them for each of the procedures that we're doing in lab. And for homework, you're getting all your charting and all your checks are checked and all your information is filled out. Because we know we turn these worksheets in for a grade. Okay, guys, now this is H6-1. This is the skilled procedure that we performed in class on Monday. We did a venipuncture practice, drawing 3 tubes on our arm, right? Make sure that you did all your charting, okay? And that you filled out your patient log, okay? Because we just did a venipuncture. We just drew 3 tubes. Remember, we drew a hemoglobin A1C that's drawn in a purple top tube that has EDTA in it, which is an anticoagulant. We drew a lipid profile, okay? And we drew it in a red top tube, a plain red top tube that had no additives in it, because this was ordered routine. You see test status up there? It wasn't ordered stat, it was ordered routine. So because we were drawing a PT, which is drawn in a light blue top tube, right? And it has sodium citrate in it, which is the additive in that tube, which is an anticoagulant, and it has to be 100% full, just like our purple top for our hemoglobin A1C has to be 100% full. But because we know, ding, 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 that bell goes off, right? That alerts us that we're drawing that PT in a light blue top tube, we are going to need a discard tube for 2 reasons. One, either we're drawing with a butterfly needle or the doctor ordered another test with that PT. Well, we see this one fits that criteria. We talked about it in class on Monday, right? We knew we would need a plain red top tube for our discard tube. And since this was not ordered stat, we could use that plain red top tube for that's our discard tube for our lipid profile. So we drew a red top out of order as our discard tube, and we're going to use it for our lipid profile. Then we drew our light blue top tube for our PT, and then we finished up with our purple top tube for our hemoglobin A1C, right? Okay, so we did this in class on Monday. Now, we went through all the procedure from applying your tourniquet, and remember, guys, you don't know what supplies you need in the real world, okay? You don't know, and you don't know where you're going to stick this patient. It's going to be the left arm, the right arm, the dorsal of the left hand, the dorsal of the right hand. You don't know if these are going to be somebody that you're going to be able to use a venipuncture setup because they have really good veins, or whether they're going to have veins that is going to require a butterfly. So the first thing to do, as we always say, is find your vein, right? By touch, not sight, okay? And then remember, you don't want to leave that tourniquet on there for any longer than a minute. So you want to go ahead and get that tourniquet off once you've located your vein by touch and you visualize exactly where you're going to stick your patient. And then we get out just our 2 alcohol prep pads, right? So make sure, we went over this today, Monday. We went over this over and over again. We're getting closer and closer to taking our venipuncture skills test so that we can stick for real, okay? And always remember what you say to your patient at each and every step, from getting them to make a fist, to the releasing their fist, to making sure that you tell them that they need to leave that on there for about 15 minutes. After that, they can take it off if it stopped bleeding, and not to lift anything heavy with that arm for about an hour, right? Okay, so now that we've moved from what we did Monday in lab on drawing our 3 tubes on our practice arm, we know right now on Monday in lecture, we reviewed on chapter 3 on urinalysis. And you guys know that due to the winter storm, 2 of our lectures unfortunately had to go online for virtual, right? So you have a lecture up on Canvas for chapter 3 on urinalysis that you guys should have already watched, filled out your study guides. You should have read chapter 3 in your textbook. And you should have watched the lecture video for toxicology chapter 9, and you should have already filled out the study guides for that and read chapter 9 in your textbook, because as we know, when we come back from spring break, we will take a lab test, a lab quiz on tube colors, and we will also take our lecture test number 2 on chapters 3 and 9, okay? So make sure you're keeping up with all that. But as we were talking today in class on Monday about verbal instructions, we talked about the instructions for patients on how to collect clean kept urine for female, right? And I showed y'all the 24-hour urine jug, and I talked to you about how they exactly collect a 24-hour urine. Now, instead of us doing on page 71, if you guys will flip to page 71, H6-2, so instead of us doing this in lab, just to make up some time, this is something you guys can do at home, okay? Now, what I want you to be able to do is to be able to instruct a patient on how to collect a clean catch urine, okay, for a female and a male, okay, and an infant. Now, so I'm going to go over each one of these with you, and then on page 73, you're going to pretend, and you can use somebody in your home if you would like, or you could just pretend like you're talking to somebody. You know, you guys have been graded on your effectiveness for learning how to talk to patients, okay, and counsel them. This is the same thing. I want you to practice doing this, okay? Now, there'll be a lot of help for you on page 73 because it goes down the list. We see a requisition form with Jane Doe's name and information on it. We see our doctor ordered a urinalysis, right? And then we all know that the first thing we're going to do is wash our hands and select our appropriate PPE for whatever we're doing with our patients, right? We're always going to make sure any area that we're working has been cleaned. Okay, we're always going to make sure that our area is stocked and organized and maintained so we can have all the supplies we need at our fingertips, right? Because it's all about doing this stuff accurately and correctly, but also doing it quickly, okay? And being organized and making sure that everything is stocked and organized and you know where all your supplies is vitally important. We also know we always perform our 3-point in quality assurance by making sure that we introduce ourselves to our patient. Who are you? Why are you there and where are you from? Identification is one of the most vital parts in healthcare. Please make sure you identify your patient properly before you do anything to them. Ask for their full name and date of birth and make sure you're comparing their name and date of birth to the requisition form, okay? Then we always want to do our medical interview. Want to ask them if they're on any medications. Have they exercised strenuously in the last 48 hours? And did your doctor ask you to follow any type of special diet or fast before having your blood drawn or having any tests done, right? And make sure the patient is comfortable when you're talking to them, okay? So make sure you check box all of those as you go through it. Read these boxes, guys. This is what we do every single day in lab, okay? And then go ahead and put your initials in 5 that you have performed all these things, okay? Then over on page 74, I want you to go step by step through 6, 7, 8, all the way down to your post-analytical phase of testing, okay? And make sure you read each and every one of them and check it off. Remember, when you're giving instructions to a patient on how to collect a clean catch urine, okay, make sure that you go back and find, here it says chart on your lab partners chart. Let's don't do that. The requisition says Jane Doe. Go back in your worksheets, find Jane Doe's chart and make sure you chart on Jane Doe's chart. So make sure, and you guys took home 3 soapy pads with yourself today after lab on Monday, and you all took home a sterile urine cup. Now, all the people in our class right now are female, so they're going to go home, sit comfortably on the toilet. Then you are going to take one of your soapy pads, open it up. You're going to open your genital area up, wipe down one side from front to back, throw it in the trash. Take your second towelette, front to back in the middle, throw it in the trash. Third one, front to back on the opposite side of the folds of your skin in your genital area so that you can clean it, because we don't want any of the bacteria, the normal flora that is around this area, to contaminate our urine specimen. We want to make sure that we're just getting any bacteria that may possibly be growing in our patient's bladder, right? Then we're going to tell them to start to urinate, and after they've started to urinate, then they will move their urine cup into the urine stream, fill up about half the cup, move it out, urinate the rest of the urine in the toilet, and then securely paste their cap on their urine container. Now, guys, remember, you will be collecting a clean catch urine at home and bring it in with you Wednesday to class. So make sure that you're taking care of everything that's on page 73 and 74. Read through it, make sure you understand it, and click it off. Being able to give correct instructions to your female patients on how to collect a clean catch urine is vitally important, and you will be tested on it. And make sure that you're charting it on Jane Doe's chart. Then quickly turn over to H6-3, where we will be talking about instructing a male patient on how to collect a clean catch urine. This is John Doe. John Doe also has a chart in the back of our worksheets. Please make sure that you also chart on his chart, okay? Same thing, guys. We always make sure we have our hands washed and we're wearing our appropriate PPE. We always make sure our area we're dealing with our patients is always well cleaned between each patient at the beginning and each day of our shift, the end of each shift. We always want to make sure our area is organized and stocked and we have all the supplies we need at our fingertips, right? We always want to make sure we introduce ourselves, ID, and medical interview of our patient. Okay, so go through that on page 75 and put your initials there instead of your lab partners, as that you read through that and you understand the steps that you must perform. Also make sure whether it's a female patient or a male patient or the parent of a child that they wash their hands prior to performing this and then wash their hands after they're done. So if you're giving instructions to a male, it would be the same thing. He needs to go into the restroom with his supplies that you have given him. He needs to make sure he washes his hands before the procedure. He will clean the tip of his penis, pulling the foreskin back if that needs to be done there. Clean around it really well. He can take the other two and clean on each side of the shaft of his penis, throwing all of them into the trash. Then he will do the same thing. He will start to urinate into the toilet. Then he will move his urine container into the stream, collect about half a cup, move it out, urinate the rest of the way into the toilet, place his cup cap securely on top of it, and then he will give it to the person in the lab. And then, of course, he will wash his hands when he finishes up. Make sure you go from 6 all the way down to putting away any equipment that you're using in your lab and making sure that you take off your gloves and wash your hands, okay? So make sure y'all click off all the boxes on 76 and make sure you read and understand that, as you will be quizzed on how to give instructions on clean catch urines. Then move to page 77, H6-4. This is instructing a patient on how to collect a 24-hour urine. This is John Doe. Again, please make sure that if your patient is Jane Doe or John Doe, that you're going back to Jane or John Doe's chart in the back of your worksheet and you're charting what you've done on your patient, okay? So, same thing. We go through 1 through 5 and click all that off. The more you practice doing all this stuff and reading and going through it makes you do it without even thinking, right? Then make sure you instruct your patient that they need to note the time they get up in the morning. You're going to send them home with that amber color 24-hour urine jug. If it has some type of preservative in it, we need to make sure we're familiar with that preservative and any caution we need to take with it, and we need to be aware of that, and we need to make our patient aware of it by looking at our material safety data sheets and knowing if there's any issues with that particular preservative. If we're not adding a preservative to it, we need to inform the patient that they need to keep that 24-hour urine container refrigerated. We typically give them a urine cup they can take home with them, as it is easier to collect it usually in a urine cup. So we tell them when they wake up in the morning, they need to note the time. Most people wake up around the same time every morning, and most people usually go to the restroom not too long after awakening. So they go into the restroom, they note the time, say 5:30, and then they urinate. We do not keep that specimen. So they urinate, and then any and every time they urinate after that morning urine, they collect it, place it into the 24-hour urine container, and if it doesn't have a preservative in it, they keep it in the refrigerator. They keep it all through the day and any time during the night, anytime they urinate. That next morning, when they wake up, say around the same time, 5:30, and they go to the bathroom, they do collect that specimen. That's the last one they collect. It is added to that 24-hour urine jug, and then they bring that in for testing. So please make sure you go through all through page 78, checking off each box that you have read it and that you understand the instructions for giving a 24-hour urine. Then let's turn to page 7986-5. This is a skilled procedure for obtaining a urine specimen from an infant or a young child. Okay? You can write your baby's name on here. Baby boy Smith, baby girl Smith, and then you will have an infant chart in the back that you can then write that patient's name on that chart and chart for that patient, okay? But there is a chart for your infant in the back, and please make sure you're charting all this on all your patients. So again, we know the procedure that we go through from washing our hands to performing our introduction and ID, right? And we will check off on those and initial that we've done that and practice doing that with possibly someone in your house if you can, okay? Now, same thing with the infant. They have special collection devices for infants. And so what you would do is you would give this special collecting device to the patient, to the parents, to take home with them to collect. Or sometimes you can go, if the patient is there, you can go into their room and you can apply this to the patient, okay? And it's set up specifically for boy or girls, infants. It has a little sticky area on it, and you pull this, the labeling of the little binder off of that, and it reveals the sticky part. And then you place it over the genital areas where the uterary meatus, where the urine comes out of either the male or the female infant. And then you just stick it onto their skin, and then you put their diaper back on. And then you can go see another patient, and you wait. When you come back, a lot of times you will open up the baby's diaper, and hopefully there will be urine in the bottom of the plastic that is connected to this device, okay? It's like a little bag. So then you can gently take it off of the baby, take the urine that is in the bottom of the plastic bag now, pour it into a urine container, put the top on it really well, and label the urine container with your baby's information, okay? Now, you can either instruct the parents how to do this and they can take it home, or sometimes it can be done in the doctor's office. So make sure you read through all these and check off all the boxes on page 80 dealing with that. Now, you guys took home urine containers and 3 moist towelettes so that you can collect a clean catch urine on yourself, okay? So you guys make sure that you do that so you can bring that into class on Wednesday, and we can do H6-6 on the analytical test of chemical urinalysis using reagent strips, okay? Now, make sure when you label your urine cup, okay, you never label the top of the container. People take those off. There can be multiple tops laying out on the counter while they're performing urinalysis. People can accidentally throw it in the trash. You always write on the urine sample cup itself, not the lid. And remember, we label with the basic 6. Sometimes that label will have other stuff on there, but you want to make sure you put your basic 6 information. So when you collect your urine Wednesday morning before you come to class, you will perform a clean catch urine. You will securely put your cap on your container, and then you will put your full name, your date of birth, the date and time you collected your urine, and your initials and room H221 on there. And then you will bring it into class on Wednesday, okay? Remember, we need at least 50% or about 50 milliliters or about half the cup, okay? And remember, we can do the testing with less than 50 milliliters, but if it's 10 milliliters or less than 10 milliliters, that's quantity non-sufficient, okay? So We will continue this H6-6 Wednesday when you guys come to class using your urine. Now, is this activity a skill procedure or an analytical test? It's an analytical test because the manual chemistry reagent strips is an analytical test that we're performing, not just a skill procedure, okay? So what 4 places must you document it? Okay, so now we're running a test, right? We talked about this earlier. We have to fill out our requisition slip, right? We have to fill out our patient's chart. We have to put it on the patient's log, and we have to check the QC log and make sure that QC has been ran on our reagent testing strips and urinalysis before we run our patient. Remember, quality control is always ran before we test our patient. And we talked about this. CLIA is the law, right? And it sets the rules and regulations for any labs that are testing human specimens. So how many levels and how often is QC ran per CLIA? There's 3 levels of controls, right? Normal, abnormally low, and abnormally high. But CLIA says we have to run at least 2 levels of controls. They must be ran every 8 hours each day of patient testing. If you are open 24 hours, then you're going to have to run controls every 8 hours, okay? And if you don't do a urinalysis on a patient all day long while you're open, then you don't have to worry about doing QC. But if you run a patient, then you do. Okay. When we come to class, we're going to check that QC log. I'm going to expect you guys to flip back and look and see if QC has been ran that day or not, and see if you need to run control. So we'll do that on Wednesday. So guys, make sure you're studying chapters 3 and 9, okay? Because on that Monday when we come back from spring break, you will take lecture test number 2 on chapters 3 and 9. Okay, we will review on Wednesday in class. Okay, we'll finish reviewing, but you will have that test. You will also have your lab test number 2 or your lab quiz number 2 on tube colors. So make sure you're prepared. I'll see you guys on Wednesday where you'll bring in your urine sample, and we'll finish doing, we're going to do H6-6 and then we will possibly start on skills procedure 7-1. Guys, please make sure you're taking out these packets this week, and especially when you have some downtime during spring break, and just go over it. Make sure that all your charting is done. Make sure your patient log is fully filled out, that all your check boxes are checked, all your I's are dotted, and your T's are crossed. Okay? I'll see you guys Wednesday in class. Have a great day.